I appreciate the opportunity to talk to you, and I'm just gonna sit here and I won't take much of your time. However, I enjoyed the presentation and everything from the hospital. I've got a few concerns. There's a lot of fine people, as everybody knows, that's had received service or medical treatment up at the hospital. Am I not speaking loud? Did you tell me? Okay. There's a lot of great people that work up there. Great employees, point of care people and everything. I've received service there. I've got friends that work there. I've had family that has worked there in the past. There's great employees that do a great job for our community. However, one of the unfortunate things that I hear too much of from current and former employees is that they don't feel that they are valued and respected in the way that we might hope for the effort and the work that they put in and the treatment that they give to people like us that show up there. I am from their administration, obviously. I'm afraid that this court and the residents of this county have gotten a taste of the disrespect that some of the employees up there have to endure on a regular basis over the last several months. Insofar as you all, a majority of you I should say, agreed to give them a tax on the ballot in November. Modified from their request, but you agreed to let them have a tax option on the ballot. And that was partly under the pretense that they were going to have these town hall meetings to explain to your constituency, the residents of this county, what that was for and to answer the questions. And everybody knows there are a lot of questions in this county about this tax. Mr. Jackson's been here before asking questions that you guys don't have answers to, and it's not your responsibility to answer. It's the hospital's responsibility. And you took them on good faith on the promise that they would hold these meetings, and you agreed to put a tax on the ballot. And they have squandered the last several months, and we can use COVID as an excuse, but it's not impossible to have a group of people get together and talk, obviously. Now we're a month out before early voting, and your absentee ballots are going to be coming in. There's no time to cobble together something. The last time that Mr. Deaton was dispatched up here, I did as Mr. Tatum suggested, go to the hospital. I went to him and asked a couple of questions to which answers were not readily available, which I completely understand. So I said, who do I contact? He told me at that time, at this meeting, that I couldn't contact anybody, that I would have opportunity to ask these type of questions at these town hall meetings that he was working with the fire departments to get organized. Now that hasn't happened, and he claims to have had some meetings with some groups somewhere at some time that evidently nobody else seemed to know about here. I'm concerned that this blatant disregard for what they said they would do, what they promised you and really the residents of this county they would do, shows a lot of disrespect, if not contempt, for the residents of this county from the administration. I differentiate between the administration and the hard-working, respectable employees that are at that facility. I hope that if this tax fails, if this tax proposal fails in November, and they were to come back to you yet again in another 6 months, I hope that you will remember the disrespect and the contempt that they have shown to you, to this court, and to your constituency, the residents of this county, if they come wanting more money from us. Because it was out of order, I'm sorry. They made an obligation, voluntarily obligated themselves to it, and they chose not to fulfill that. And there are rumors and questions in abundance to which we cannot obtain answers currently. So I hope that this is not forgotten. But I appreciate your time.
Thank you.
The speaker.
Ozark Health is a wonderful diamond in the rough, I call it. It's a small rural hospital. We're a little town. We serve a fairly good-sized county, probably the best facilities, best medical staff of any small rural area that I've ever known of or I've ever seen or practiced in.
Many communities our size do not have a hospital. And so we're very fortunate that years ago, the people of Van Buren County made a decision to have great local health care.
The quality of care that we have with our surgeons, our ancillary services, and the quality of services and the amount of services we have is kind of unparalleled in the state.
I will put our hospital, our small hospital, up against any big size hospital for the quality of care.
It's a real attractive thing for Van Buren County to have a hospital, a nursing home, an emergency room.
Although we are small, there is not much difference with the bigger ER. They can do what we cannot do here.
Why should I want to drive down there when I can come up here with people that don't treat you like a number, treat you like a person, and actually care?
Living in a rural community, having access to healthcare is critical. Working in a rural health clinic specifically, I know the importance of having access to critical care, emergency services, radiology services, lab, not only just from the hospital standpoint, but as well as the local nursing home that's attached. It has been a blessing to our community.
The biggest thing is having facilities nearby, driving time. If you have patients that need a colonoscopy, they can do it here. If they can get, gallbladder surgery, they can do it here.
Let's imagine we weren't here. Let's imagine we've dried up like some of the other rural hospitals in the state. If anyone gets sick here, it's an ambulance ride to Conway. Or Harrison, that's the closest way to get medical care. And a lot of times in acute strokes, acute heart attacks, some surgical emergencies, that's a long way to go. That's an hour and a half drive, and people die in that time.
Say if you're having a stroke, you can come here, get the clot-busting medication, and then you're virtually on your way to recovery when we transfer you to another hospital, versus if we didn't have this hospital. Your time is essential, whether it's your heart, your brain, whatever it is. If you don't have a hospital in this rural community, then you're wasting precious time in life and possibly not being able to get a lot of your abilities back.
Certain medication should be given at a certain time interval. If this time interval is missed for many reasons, driving to Conway, driving to Little Rock, you're out of this window. This medication never can be given back, and there may be consequences serious of this not be given.
When he had his stroke, if we had not gotten here in 15 minutes, he would not be sitting here like this now.
When I got here, they apparently put me immediately on the table there, and they opened up the Arkansas Saves telelink, and a doctor was sitting there looking at me. The expert in Little Rock was sitting there looking at me, and he said, give him a CT scan of his brain and determine if it's ischemic or hemorrhagic. And they determined it was ischemic, so they said, okay, issue TPA. My God, that was the thing that saved me.
We have partnered with the leading cancer treatment center in the state of Arkansas, CARTI, to bring world-class cancer treatment to Van Buren County.
Some chemos ranges between 1 to 2 hours to 8 hours. So when a patient is sick, diagnosed with a cancer, traveling to Little Rock, that's a 1 and 1 hour, 2 hour traveling, and spending another hour to get into the chair, and then 8 hours. That's a pretty long day for sick people.
Back in the old days, you had to go south, get on the interstate, go to Conway, or go to Little Rock to get your chemo treatments. My mom, for a year and a half, was able to take them right here in Clinton, Arkansas. Big peace of mind for my mom, right here at home, having things done. Didn't have to get very far from the house.
It's the level of care here is so amazing. And it's the people that make it that way.
Ozark Health is special. We're a family. The ER is my home away from home. I spend just as much time in the ER as I do with my own family.
You walk around this hospital, you see smiles. You see people, our employees, from our janitorial staff to our house cleaning to everybody, they're here because they want to be here. Local people taking care of local people.
I've been in big hospitals, I've worked in big hospitals, but there's nothing like the individual care that you get here. It's phenomenal.
I mean, these people took time to explain what each thing was, why they were doing it, and I mean, I love them.
I know that I can say that I am very blessed to work here. It's like a family up here. These people genuinely that I work with care for the people that we take care of.
I've enjoyed it here because it is more like a family. You are able to, believe it or not, spend a little more time one-on-one with the patients.
Here is more family. You know, everybody took the time to talk to you. And when therapy come by, they sat and talked to Dad, and especially an older person, they sometimes need that one-on-one, and he got it from everybody.
Our purpose for being here is to serve people. And when I hear stories about the great care somebody received here, about the difference we made in their lives, it fills me with pride that we're able to do that. And what I'm really proud of is the fact that it is local people working here that made that happen.
I've known Sierra ever since she was wearing diapers, and I know her daddy real well. She was watching, as I was exercising. Something wasn't showing up right. And she took the initiative. She got some doctors up there and said, "This ain't right." Said, "Something's wrong." And that's when they found out that 2 of my bypasses had collapsed. And I will go to my grave thanking her for what time that she has given me. Because if it hadn't been for this young lady sitting right here, I wouldn't be sitting here today. The good Lord give her the calling to what she's doing. And I'm living proof of it.
They save lives here, and that's what matters. You bring your loved one in here and they're going to get the highest level of care.
These are hometown people taking care of the people that you see in the grocery store, you see on a Friday night on the football field, you see them in church. These are neighbors taking care of neighbors, and when you can take that level of compassion and not only take care of your neighbors to that degree, but take care of somebody off the street that you've never met and treat them like you've known them your entire life. People come here because a lot of the times this is the closest place and they've got nowhere else to go but here. But when they get here, they don't want to go anywhere else but here.
I love my job, people I work with. It's just rewarding to come in each day and know that you've had an impact on someone's life.
Not that I want to go to the hospital, this last place that I really want to go, but this is a place I'd recommend to anybody.
My goal is to have the best team of healthcare professionals possible, and I believe that we have achieved that. The people that work at Ozark Health are qualified to work in any healthcare facility anywhere that they choose. And I'm really proud that they choose to work here and be a part of our team.
Just to clarify, Debbie Tatum, her dad was in the hospital, and he was in another hospital in another town, and he could not have any visitors. He was scared, and after a few days, he was able to transfer to our hospital, where we do permit visitors. It's a hospital by hospital decision, so we made a decision not to bar all visitors, and so that was just her talking about that. Anyway, I'd like to just spend a moment, give you an update on how things are going with Ozark Health. As you are aware, we have a pandemic going on, so there's been a lot happening since especially the middle part of March in Arkansas. Arkansas hospitals, as of midnight last night, had 389 patients in hospital beds. That's the entirety of Arkansas. That is down 25% from our peak in Arkansas on August the 5th. On that day, we had 521 patients in hospital. And so we're down 25%. Of the 389 patients in Arkansas hospitals today, 196 are in ICU care and 69 of those are on ventilators. So while we're seeing our numbers across the state decline as far as hospital admissions go for COVID-19 patients, it's still ongoing. Ozark Health, as of today, is in very good condition concerning the ability to test for COVID patients, also to provide all kinds of care. Through the pandemic, we have never run out of critical supplies and orders that is needed to run the nursing home or the hospital. A lot of that was because of planning over the past several years to prepare for emergencies. There's a great ongoing emergency preparedness effort that's been in Arkansas hospitals for several years. And so as a result of that, hospitals throughout Arkansas have been able to stockpile emergency supplies to prepare for a disaster or an emergency. Of course, we've had one. Many people could not order and get personal protective equipment. Sometimes it's just impossible to get. And we were very fortunate to have had a stock of that. We never ran out. Testing capacity, we have the capacity today to test as many as 350 people for COVID if we needed to do that. To date this year, we've tested about 750. So we expect that our current supply will take us through up to the end of the pandemic, whenever that is. We do have another 350 capacity that's coming and should be on site next week. So that would put us up to about 650 tests, minus what we've done between today and next week when we get our replenishment of testing supplies. Several weeks ago, Ozark Health developed rapid testing capabilities. So we could do a test between 15 and 30 minutes. Before that, it was 2, 3, 4 days or longer. And so since we've started doing the rapid testing, about 80% of our tests that we conduct are actually the rapid test. We do have some send-out tests that we do, but the majority of them are rapid tests. PCR tests are the tests that are sent out. There was some concern early on with rapid testing as to its accuracy. And so we regularly take a rapid test result and then we send out a second sample of the same patient to a outside laboratory. And as of today, we have not had one negative test result that has been a false negative. So if anybody has gotten a negative test result from our rapid testing, as of today, we have never had any incident of a false negative. So if you get a negative test, you can be assured of it as of what we've experienced here today. Again, like I mentioned, our PPE supplies are good. There has been a lot of difficulty that some of the area clinics and EMSs have had since the pandemic started. And so we've taken some of our PPE and actually donated it to some of the area medical clinics and dental clinics and ambulance services. So sometimes we contact people to see if they need anything. Sometimes they contact us to ask if we have anything. We have never charged anybody for any of the PPE supplies that we've provided them. Ozark Health has acquired several doses of remdesivir, which is the most common treatment for COVID patients. Should we have an inpatient COVID patient that needs that medication, we have it here. The cost for us to acquire enough to treat 10 patients is almost $33,000. So expensive, but if it can save someone's life, then I think it's going to be worth it. We also have a supply of hydroxychloroquine, And as you know, depending on whether you're Democrat or Republican, that may be a choice you need to make. So we have both kinds. You have to have a little humor in these trying times. Hospital volume as of today is on average, between 80 and 100% of our pre-COVID levels. I don't know that we're up to 100% in many areas, but our emergency department was down about 40% during the depths of the pandemic back in April. April was our worst month in years as far as hospital services, volume. And so now the ER, as of today, is running about 80% of its pre-COVID numbers. So people are beginning to come back to the emergency department. They were really scared there for a while. Our concerns as healthcare professionals is that they put off care that they needed. In California, ER visits were down about 40 to 50%. Stroke cases in emergency departments were down 40%. I have a hard time believing strokes reduced by 40%. My concern was that people weren't receiving their care. But last year, just to give you some year-to-date perspective on how the year that ended in June compared to the prior year, even with the pandemic, our numbers are pretty close to what they were last year. Outpatient volumes range between 1 and 5% of what they were last year, which means they were down. Some departments were about even. Prior to the pandemic, Ozark Health volume in most every department was above the prior year's level. So we were having a better year than we had the prior year. But when the COVID hit, that changed some things. As a result of decreased volumes across the state and across the country, a lot of hospitals laid off a lot of employees. Some hospitals didn't, but a lot did. And Ozark Health, the leadership team, we just made a decision early on not to do layoffs until we saw more what was going to happen. And we just never laid anybody off. And so I'm glad we did not do layoffs, because now that our volume's approaching what it was before, that puts us in a good position to have adequate staff. We do have a few positions we're trying to hire for. Nursing home nurses, CNAs, we have a need there for some of those folks. We do need another respiratory therapist or two, but primarily we have enough staff other than that. Well, we have enough staff to serve everybody, but we've got some overtime and some extra shifts people are working. But anyway, to sum it up, we had no layoffs, we had no critical supply shortages, and we have an awesome staff at Ozark Health. Just to kind of go back to the emergency department volume, we had 7,295 ER visits last year, and that was down about 3% from the prior year. Interestingly enough, we had 1,287 ambulances come to our hospital last year, and that's up about 21% from the prior year. And so the question may be, if you had 3% fewer overall patients, why did you have 21% more ambulances? And my speculation is that the ambulances tend to bring in more severely ill people, and those people continue to come to the emergency department for the most part. And actually, we had an increase in volume there. There were times when the ambulance services were having a hard time getting a patient accepted to another hospital, maybe because of the COVID pandemic. So that could have had a little bit to do with it. Radiology had more than 17,000 radiology exams last year. Laboratory conducted 73,005 lab tests last year. Our respiratory therapists conducted about 17,300 respiratory tests and procedures. We had 916 surgeries and GI procedures in our operating room. Home health was down last year by about 9%. There was a time during the pandemic that patients were reluctant to allow even healthcare professionals to come in their home. But that's beginning to come back up. The nursing home ended with a census of 77, and that was an increase of 5% over the prior year. As you recall, we had a flood in 2018 that resulted in a lot of flood damage, and we had to close off sections of the facility while we were effecting those repairs, and that served to bring the census down. However, the census began to come up in the fall of 2019, and when the pandemic hit this year, we were about 85 residents was the average. Today, that's down to about 75. Because what happened was the pandemic occurred and nursing homes were directed by the governor and the director of the Arkansas Department of Health to not allow visitors. And at that point, admissions really slowed down. People were real reluctant to place a loved one in a nursing home when knowing they could not have contact with them, except through looking through the window or FaceTime visits or telephone calls. We think once the pandemic eases up, that the census will come back up to between 85 and 90 residents. And as of this week, we have about 347 employees in our employment. And that's full-time, part-time, and PRN employees. And those are employees that are called in on a shift basis as needed. So that's a real quick summary of our year, and I wish it would have been better. I wish we wouldn't have a pandemic, but I'll tell you, the people in the county at Ozark Health, but also all the medical clinics, I'm really proud of the way the medical community come together and coordinated. Clinics, the health department has really been helpful. Ambulance services done a great job. And so I'm really just pleased to announce that Ozark Health is in pretty good condition going forward, given what's happened last year. So thank you very much.
Any questions for Mr. D?
I have a comment. I volunteer with Tertiary Ambulance Service, and I was at our monthly meeting a couple of weeks ago, and they were saying that we can only order from our supplier extra small gloves, and I mean, the majority of our volunteers are men and can't wear extra small gloves. So I actually contacted Mr. Deaton and asked them if they had a surplus, and he fulfilled our need and then some. And actually, I just sent him the text of what we needed, and he texted back that he had delivered it. So that was phenomenal. Another thing was when I went through and did my EMS course, I did my clinicals at the local ER here, and one of the doctors in that video, Dr. Vuk, he was my favorite, so I made sure and scheduled my clinicals on the days that he was there. But he made me work. He made me get in and learn the things, but when we would leave the room with the patient, he would take the time and explain to me everything that we did and why we did it, and he made the learning experience very worthwhile. So I got to see that side of it as well. So he's definitely a diamond in the rough. One thing that I didn't see in the video and nobody likes to talk about is hospice. And my grandpa spent his last days, his last minutes in that hospital, and the hospice nurses, the staff, the doctors, they were amazing. And when we cried, they cried with us. So they made a terrible situation as bearable as it could possibly be, and we could not be more grateful for that. So, amazing resource. I also have a comment. I hadn't seen the video. I was very impressed by the video. I'm proud of that. And I've talked to Mr. Deaton recently. My grandmother, during this pandemic, had a heart attack, and we're dealing with the realities of congestive heart failure. And you forget that feeling of urgency when you need help and you need it then. And so we've dealt with that a lot in the last couple of months, and having Ozark Health in the way that we have been treated. And most of the times we've ended up going on eventually to another hospital, and during these strange times you can't see them, and we're prepared for that now. But being able to have something close in the way that we've been treated, and just it had been years since I had felt that urgency of when you need it now. And so I have been
very much reminded how good it is to have this hospital this close.
Myself, I got a comment and a question. One is I too have had a good experience at the hospital and the nursing home. My father was in there for the last of his days, and I couldn't ask for better care. I've been in the EMS field for a long time, and I think it's excellent care, and I also believe in the hospital. I believe that it's the major infrastructure of the county, or one of, and I've never been treated wrong up there, let's just put it that way. But I do have a question, is there's a lot of people that don't feel like that. And what is the hospital doing to try to talk to some of the people that's out that has these concerns? I know when we were talking about the tax and everything, it was brought up that you guys may have some type of community forums or something where people can come and ask questions, because there's nothing like face, of course, the COVID stuff hit, and I understand that. And I don't know how to go around that. Of course, this is the big social media era, I guess you might say, and I'm not always on board with that, but if you do get on social media, there is a lot of negativity out there about the hospital. I'm not saying I feel that way. I'm just saying, these people deserve to be asked questions, and I'm not sure how to address that, but I think it is up to the hospital to address those concerns to the people of the county, especially if it's going to be their tax money that's, put out there. So, I don't know what the answer is, but now with the COVID stuff,
Well, I've addressed a number of groups since then. So just because I've addressed one group doesn't mean that I'm not going to. And so we've talked about having town hall meetings for the public. Of course, there's a lot of concern there with, we still have people that will not come to the hospital for emergency care. And so we're discussing having that, maybe some virtual town hall meetings to address that. But I'm scheduled to be some places over the next several weeks, and so I imagine I will. But if any group would like for me to come address them that I don't reach out to, they're free to contact me and ask me to do that. So, one of the things I'd like to address with Justice Brown is she talked about her which family member was it? Your grandmother? And she was transferred to the hospital. There's a misconception that everybody that comes to our emergency department gets transferred to another hospital. Over 88% of all the patients that come to our emergency department actually receive all their care there. And either they're discharged home from there or they're admitted to our hospital. A little under 12% this past year were actually transferred. So the vast majority, almost 90% of all the patients that come to our ER over the last 2 or 3 years have received all of their care there and not been transferred. Obviously, if they're having a stroke, we're going to treat them, and we are a stroke center participating with the Arkansas Saves program, and we have, as General Crocker described there, we have the ability to connect with UAMS and connect with a vascular neurologist wherever they may be. Sometimes they're in Little Rock. The times I've observed it, the neurologists have been in Fort Smith. So they're from all over, and they communicate with our emergency room physicians and staff, and we conduct the CT scan, all the lab tests, and if it's an appropriate case, we'll administer the TPA clot-busting drug. Many times by the time the patient has gotten to their destination hospital for their follow-up care, as they will need, many times their symptoms have partially or completely resolved, which means they've got movement, and so that's what General Crocker experienced. So by the time he got to this destination hospital, his symptoms had almost all gone away, and that kept him from being permanently disabled. I don't know if he drives or not. I think he may, and he's up living life. So But I just want to address that with you because there is this misconception about all they're going to do is transfer you to another hospital, and that is simply not the case unless it's appropriate.
Speaking of social media, could you clear up what has been on there today about the wreck in front of the hospital?
I don't know about that. I knew there was an accident there, but I have no details on that.
Well, on Facebook, some are saying that the hospital refused to take them or refused to let the helicopter land.
Well, there was a helicopter or 3 that landed there today. 2, yes.
Yeah, I think they had to call. I think the first, I think there was a call made to see if they could land there. I do know what I don't know about Facebook, but
Well, I just seen it on
it was on the
Facebook
radio.
and wanted it cleared.
Right.
I don't know what that situation is.
I don't have the details on that, I'm sorry. But as far as refusing to let somebody land, that would not have been the case. Unless there was already a helicopter there. Obviously, there may have been a bird sitting there on the pad or something, but I'm not aware.
I think the call come in as the ambulance told 911 to get a hold of them and tell them to land the helicopters at the hospital, and they said that they'd have to get approval first before they could land there, because they weren't allowed to land there, on the radio. Now, what all that is, I don't know.
Right.
Well, but I'm just saying.
I don't know anything about that, but I'll certainly look into it.
Any other questions from the court?
I do have a question about the proposed tax. So I haven't seen where y'all have talked with anyone about, actual numbers. You say what you might need, but I'm sure if it's actually needed, if y'all can come up with some real numbers as to what your budget is and what this tax is actually going for, you might get some support, but I haven't seen any kind of public forum, anything, and when you say, the COVID, yeah, it's kind of hard to do a public forum, but if you need the money, let's do a public forum, let's distance everyone, let's get some real numbers before we just throw a tax in on a community that's already kind of hurt financially. I know y'all's numbers have been down. Everyone that does business in the county's got numbers down. So, this is just kind of salt in the wound, asking for more money. I love our hospital. I've been to our hospital, and there's some wonderful people there, but without some real numbers, you're just saying, hey, we need money, give it to us, and we haven't seen where you're actually needing the money, because it is kind of a bad time to be asking our residents for some more money.
Well, I would like to clarify something. The present 1% sales tax that was used to construct the hospital and expand the hospital recently, when that tax goes off, that's a 1% tax. And then that 1% would go away. If this tax is approved by the citizens, actually, if that happens this time next year, the sales tax in Van Buren County will be exactly the way it is today. So it's not a tax increase. But I understand.
Yeah, but it's sure not a decrease.
I understand your point, yes, sir.
So, in a bad time, and like I say, some real numbers might actually help your case a little bit.
Are you able to use any of that tax? I realize it's not your building. Are you able to use any of that tax to maintain the building at all?
That's my understanding. It would be used for maintenance or capital needs of replacing the roof. Some things are considered maintenance, replacing motors. I mean, we have motors throughout the building that when they go out, they're several $1,000s each, Our HVAC, an example would be our HVAC system is computer control. We have over 150,000 square feet. To replace that system completely would be over $1 million. So that's just the computer controls. And of course, the building is over 16 years old now. And so anything electronic or mechanical will eventually go out. So to address the gentleman's concern, it's items like that. And so we will get some information together. Now, it's hard to predict what our needs are going to be 5 or 10 years from now, but we can give you some information on what we foresee that our needs are going to be.
I think a projection of how you would like to use the money would
Right.
be helpful. If you are able to use it on building maintenance. I will say that I've had more than one person come up, and the misconception is that you have a free building. So if you are able to use it to maintain that building and provide employment and all that other stuff, then, you know, it's not just a free building that you're benefiting from, so.
You know, there is the conception it's been a free building, and for the most part, you know, the county partnered with us for us to operate, you know, the hospital and nursing home. But back in the early days of the hospital being, occupying the current campus, Ozark Health invested more than $2.3 million ourselves into finishing out the building and equipping it. So the county did not pay for the entirety of that, but they paid for the majority of it.
I just think being open as you can possibly be is gonna allow people to be more open with their wallets.
Right.
So.
Any other comments or questions or public comments? I'm kind of curious about the ventilator. I've heard about these ventilators. Do we have those?
Actually, we have 7 ventilators.
Oh, wow.
And we use them
Have
from
you had
time.
to use them any?
We use them from time to time. Thankfully, we've never had to use all 7 at the same time. We've been very blessed, as you know, in Van Buren County, North Central Arkansas in general, with the pandemic. It's just not been necessary for us to use them for a COVID patient. But they're there if we need them, and they're there, you know. And if another hospital had a shortage of ventilators, obviously we would enter into a sharing with them. But most hospitals our size do not have 7 ventilators.
Yeah,
So over the years, we've just acquired those, and we have them. And there's been times we've had a few in use at the same time. I think we've been exceptionally prepared for the COVID pandemic. Yes, ma'am.
I'm going to end with this. I'm not going to say anything else, I promise. Whether you're for or against the tax, I realize it's money out of your pocket, but I think that it is a good resource for our county. Everybody wants to see Van Buren County grow, but you have to consider that with growth comes expenses. And 347 employees, that's a lot of employees. So that's a lot of people spending money in our grocery stores, at our gas stations. So if you want this county to grow, you have to have the resources. That's just the way that I see it. So.
Any other comments about the hospital?
I'll say one thing.
Do we have any figures on how many COVID cases we have in Van Buren County at this point?
I have not checked that today.
17 active positive.
The county judge has generally been a better
well,
expert on that than I have. From a deputy.
If you couldn't tell me, I was gonna ask him.
Yeah. We're down to 17. Yes, sir.
Just one thing about the nursing home in particular. My wife's father is in the nursing home, and we see him every day through the window. I don't know if there's any other people that are seeing their relatives every day, but we are. And the staff over there are phenomenal. They are just phenomenal. We call normally about 8:45 every day. I think they actually sit by the phone and wait for us. And ask, you know, can you get him ready and get his headset on? We have a little microphone he talks into, which makes things so much easier. And his hearing aid out, or otherwise they talk to each other and you can't hear. But we've had no problems. We had one visit inside, and it did not go well. And the reason being is because Dad can read lips. With a mask on and 8 feet away, we were more than 6 feet. He couldn't understand what we were saying. And he was having some trouble with hearing also. So we don't do those. It's better to go right there to the window. We can touch him on the glass, you know. But I wanted to thank Mr. Deep because the staff there are phenomenal with us, and I'm sure they are with the other families that show up for window visits. But it's a really great thing. They need this. The patients need to see people.